Hey everyone, is dementia something that has to happen? Is it just going to be part of a large percentage of people who are over the age of 60 future? Or are there things that we can do about it? Can dementia actually be prevented? Now, when we're talking about dementia, it's really important that we realize that there are different stages of dementia. Now, if you wait to get to the end stage of dementia, there's really not a lot you can do. So, what we are going to talk about is how to identify where you're at, but then what can you actually do to reduce your risk of getting dementia? What are labs that can be done? Is there imaging that has value? And then what are other lifestyle factors that you can do to take control of your health? So, first, when we look at dementia, there's a lot of questions people have about Alzheimer's versus dementia. Well, if you think about it like a car, okay, the type of car that you drive may be a Honda, right? But Honda has multiple types of cars. And so Alzheimer's is a type. Okay. So dementia is the overarching one. And then you have Alzheimer's, you have vascular, you have Lewy body, and you have frontotemporal dementia. So, like frontotemporal is what Bruce Willis has. Okay. Alzheimer's is the most common, followed by vascular dementia. And the rates of dementia are continuing to grow up, to go up. Now, is it purely related to the fact that people live longer? No, that's not enough to explain it. And we're also seeing the age at which people get dementia is going down, down, and down, which is very concerning because you have people who are hitting the age that they should be retiring. And instead of retiring, they're now in a memory care facility because they have dementia. But what if that didn't have to be the case? What are things that you could do to set the stage to know where you're at, but also to prevent it? Because most dementias start 20 to 30 years before you ever get diagnosed. It's not something that just creeps up, that magically appears one day. It creeps up on you slowly, but you don't even realize it's an issue till it tends to be a little too late. Unfortunately, that's where I see most people. And it's really sad because there's not a lot you can do. But if we can be proactive, we can change our fate and our future because we have all seen a loved one or we have a friend who had a loved one who's went through dementia. And it's heartbreaking. It takes a big toll on the family emotionally, rips families apart, but also financially, it is really, really expensive to try to go through that process, especially if you have to put someone in a memory care facility. Those are not cheap. So, who does dementia actually impact? Well, 2 out of 3 people who are going to be diagnosed with Alzheimer's are going to be females. So, that's a really big thing. And from the time a female is born, they actually have a higher risk of Alzheimer's disease than they do breast cancer. Now, why is this concerning? Well, during the month of October is Breast Cancer Awareness Month. And you got, you know, buses, you've got airplanes, you've got the NFL. Everyone is talking about get your mammogram, get your mammogram, get your screening for breast cancer. And then November, the very next month, is Alzheimer's Awareness Month. And no one's talking about anything. Like it's as if it doesn't even exist. Many more people are impacted by it. It costs way more to society, but we basically ignore it as if it doesn't exist. Now, maybe that's because, well, they don't really think we've got a good way to prevent it. But once again, that is changing and it's not true. Now, the very first thing we are going to do is one, well, what if you could get imaging to know where you're at, right? Like if you get mammograms or else if you get colon cancer screenings, right? You get a colonoscopy. Colonoscopy is meant to let you know what is the health of your colon. So if you see changes, you know you should be concerned and there's things you should do about it. Well, what if you can do the same thing for dementia if there's markers that we can use? So we are going to go into that. Now, Dennis commented and said a psychiatrist told him that chronic untreated psychosis can lead to dementia. Now, there are a lot of research that ties mental health disorders to increased risk of pretty much any type of dementia, whether it's Alzheimer's, frontotemporal, or Lewy body specifically. And that's depression, that's anxiety, that's bipolar. Okay. All of those do increase the risk. And so psychosis would definitely fall within that. But why does it fall within it? And that's some of the stuff that we'll actually be covering tonight. Now, very first thing I want to do is I'm going to share my screen. And here we go. Very first thing, faster brain atrophy linked to MCI, so mild cognitive impairment. Okay. Mild cognitive impairment means you have memory issues. And when you do a test, you actually are starting to show some deficits, but it's not enough to impact your daily life where you can't take care of yourself. You can still work and everything else. Problem is, research has estimated that nearly 8 million or so Americans have mild cognitive impairment and they have no clue because they're not being properly diagnosed and evaluated for it, which is very concerning. So, whenever I say 8 million, that was over 90% of the people who they think have it have never been diagnosed. So, what they see, right, is a long term brain imaging study in adults showed faster rates of atrophy. So, atrophy is shrinking of the brain in certain brain structures to be associated with it. Okay. So, what they did, right, was they looked at people over a period of time. They found different parts of the brain were going to be reduced. Now, which we'll talk about this later, right? But people with high levels of atrophy in the white matter, and you might be like, how do you even measure that? We're going to talk about that. And then enlargement in the ventricles, which we'll also talk about. What are the ventricles? Can you measure this? Saw progression to mild cognitive impairment. Also know that diabetes, okay, so when they say diabetes mellitus, that's just type 2 diabetes, okay, was associated also with progression. Now, so once again, right, certain parts of the brain, specifically the white matter, the ventricles changing sizes, plays a big role. So what we're going to do is let's look at imaging that can actually be done to let you know where you're at. So this is a screenshot that I did, Kate, and now I've removed any and all patient identifiers. Even the date you see there is just the date that I've clipped it. Now, this is a MRI that has software called NeuroQuant software done at the same time to tell you how big each and every part of the brain is in relationship to someone else of your age range. Now, this is a test where actually my experience, insurance has covered it many a times, whether people had Medicare or private insurance. But even if they didn't, you can get it done for under $1,000, which is really reasonable because this is a test that I honestly think everyone should be getting starting at the age of 50. And after that, right, every 5 years, know where you are at. I'm less worried about a brain that stays in the 30th percentile the whole way through than I am a brain that starts in the 70th and 10 years later is the 30th, right? It's like, whoa, that's, you're losing a lot more than you should be because we're all losing brain cells as we age. And so our brain is naturally shrinking, but there's a rate that is acceptable. So what we know from that one research, right? They said cerebral white matter. So white matter is impaired. That increases the likelihood. Next, cortical gray matter. Okay. So white matter is all this inside stuff. Gray matter would be on the outside. So that's actually your brain cells, your neurons. And then ventricles. Ventricles, if I zoom in here, right, you see this black area. Okay. This is where you have what's called cerebral spinal fluid. It flows through it. As the brain gets smaller, so you see all these gaps here. Okay. That's much more than you should have. And this is because the brain is atrophied. So as the brain shrinks, ventricles get bigger. So what we can basically do is say, okay, well, we have whole brain volume, which is in the 6th percentile, which isn't good. And then we also have the ventricles, which once again, we want ventricles to not be massive, right? 50th percentile, whatever, 25th percentile, great. But the higher the ventricle number goes, the more atrophied the ventricles are, which is not a good thing. So we're seeing enlarged ventricles. Next, it breaks down other parts of the brain. So basal ganglia, which can actually be used. Some of these markers, even for like Parkinson's disease, there's parts of the cingulate cortex that also impact mood and memory. But, right, we've got temporal lobes. When most people think of Alzheimer's, they think about amygdala, the parahippocampal region, okay, and ultimately the temporal lobes as a whole. So this is a big thing to know, right? Know where you are at, right? Get this done every 5 years. It's worth the investment, even if insurance doesn't cover it. Because there's different things that can impact certain parts of the brain compared to whole parts of the brain. Because once again, maybe there's an Alzheimer's like dementia, maybe there's a vascular, maybe there's a frontotemporal, and imaging is part of the clue as to which way someone is possibly going. So, imaging, highly valuable. Please, please, please get it done. This is now becoming popular enough that pretty much any major city. So, I'm in Tampa, right? We're going to have multiple places here that do it. But even when I lived in Idaho, in a population that was much smaller, there was still a couple imaging facilities that I could get this done for patients without much of an issue. So, imaging, right? We know changes in imaging increase likelihood of mild cognitive impairment. Mild cognitive impairment is a precursor to dementia. So, know where you're at. Now, what's actually occurring in the brain that can contribute to dementia? All right, here we go. So, this is from an article, The Role of Peripheral Inflammatory Insults in Alzheimer's Disease, because the body does not exist in isolation. Okay. This is the biggest mistake I think we have in the whole medical world, even in the natural health space, is we try to separate out parts of the body and we act like one part doesn't influence the other. Now, what are some of these contributing conditions, right? Because ultimately, when we look at about Alzheimer's, this is something that's been going on for 20 to 30 years by the time you ever get a diagnosis. So, right, we see autoimmune based issues, inflammatory bowel disease, which would be like ulcerative colitis. Okay. We have Crohn's disease. We have rheumatoid arthritis. We have periodontal. So that's gum health. Gum health does matter. The diet that people are consuming, stress, sleep, which we'll talk a lot about sleep, sedentary lifestyle, we'll talk about exercise, gut microbiome dysbiosis. Now, there's also some acute stuff that can really throw people for a loop. Even surgery can make someone's dementia worse or tip them in that direction. I've definitely seen that occur, even with people recovering from concussions who they were doing well and then they had surgery and it kind of messed with them. Infections are definitely known to impact the inflammatory state and lead to progression of dementia, even when people were stable. Now, you got COVID, you got pneumonia is a big one. As people get older, even urinary tract infections, tissue damage, and then critical illness, the more severe, right? End up in ICU, the worse it's probably going to be. Next, we're here metabolic and immune system dysregulation, unraveling the connection between diabetes, right? Arthritis, inflammatory issues. So when we look at this, right? Diabetes is a contributor, right? It is very much a known contributor to dementia. Insulin resistance, which we'll talk about more. Inflammatory bowel disease causes imbalance of your gut bacteria, messes with the lining of your gut, which isn't good. Rheumatoid arthritis, creating which is an autoimmune response, right? These create chronic inflammation. Cytokine are basically chemical messengers. And these all contribute to things with Alzheimer's, right? Cognitive decline, and then some of the pathology that you see with tau, amyloid, and then ultimately the unresolved neuroinflammation. So if you have questions, let me know, but we're going to keep working through these up here next. This is kind of, we're just really beating it. So here's another thing, right? Risk factors for dementia. Some people are going to learn better from charts. So I really wanted to put this here. But we've got smoking, BMI, we've got fatty liver disease, lots and lots of people with fatty liver disease, and they have no clue. Gut microbiome, and once again, you do not need to have digestive issues to have alterations in your gut microbiome. Okay. You do not need bloating. You do not need constipation. You do not need heartburn or food reactions to get help with your gut. Lipids, lipoprotein, triglycerides, stuff, hypertension. Hypertension is a known contributor. And there are some genetic factors. There really are. But everything around here makes your genetics matter 10 times more. So if you get everything under control, you reduce your risk. Diabetes, which we've talked about, diet, and then physical activity or lack thereof. And then once again, right, we're going to beat it one last time because I can't stress it enough. And some of you are going to like one graph versus another. Chronic inflammatory state, right? Gut microbiome, hypertension, obesity. Even as we age, our system becomes more inflamed. So for some people, that's why you may notice certain things impact you more as you get older. Okay. Because there are changes in the body, and then infection, and then depression, which we did talk about how mental health does play a role in this, and then ultimately type 2 diabetes. So, all right. So, what are some of the things that we should be aware about? One is metabolic syndrome. Okay. Metabolic syndrome is obesity, blood sugar, hypertension, lipid, cholesterol panels, triglycerides, and stuff like that. Okay. So, ultimately, we know that insulin is super important in everything. So, hypertension, obesity, diabetes, and hyperlipidemia, these all ultimately impact the blood brain barrier, increase the likelihood of dementia. Now, there's reasons why each one of these do it. But as we're doing this, we're talking about what happens in the brain to contribute to dementia. What are things that play a role? This also gives you insights into what labs you need to have done. And now, when someone says, hey, you know what? You got diabetes, I want you to think I'm at increased risk of dementia. And if you don't care about getting this controlled just for diabetes' sake, get it controlled from a dementia perspective. Okay. You'll be much happier if you did. And then ultimately, this looks at signaling of the brain, right? With insulin, right? When insulin's not signaling in the way it should be, amyloid beta issues, tau issues, insulin doesn't get through the blood-brain barrier, ultimately chronic inflammation. You disrupt your gut-brain axis and how that's functioned. And then you end up with cardiovascular disease, okay? Not only in your heart, but you end up with cardiovascular disease in your brain. Now, we've covered a lot so far, right? We've talked about imaging. We have talked about a wide variety of things that contribute to the development of any type of dementia. Specifically, we've been focusing on Alzheimer's. Now, I'm not going to go into each one of those because we could literally spend 30 minutes or an hour on each topic and we still wouldn't cover it insufficient. I want to focus on what are things that could be done now. So, this is a commentary article that's called New Diagnostic Criteria for Alzheimer's Will Change Practice. Well, now why do they say that, right? Well, because you didn't get diagnosed with Alzheimer's unless everything else had been ruled out, and it was typically at death, right? When they would do an autopsy to say like, well, I guess you're right. Like they had it or no, they didn't. So what are they looking at? Well, currently, biomarkers for accurate diagnosis are available only by testing cerebral spinal fluid or by a PET scan. Now, no one wants, right, CSF test. No one wants it. What the research is going to now is blood tests, right? Boom, right here, where you give blood for anything else, getting different labs tested, amyloid beta 42, hybrid amyloid beta 4240, P phosphorylated tau protein, which is p-tau, which we'll talk about different ones. Now, what they found was that if they used the ratios of these, they could actually predict it about 90% of the time. So, and these are tests that are becoming more and more available. Before these tests came about, though, it was really about saying, was there anything else, right? Because there are B vitamin issues, there are folate issues, there are thyroid issues, there are people who multi-infarct, so those are basically mini strokes that are occurring that also can cause it. So if you can know where you're at and what we call pre-dementia, right? This is you have changes occurring in your brain before there's an increase of symptoms. That is the sweet spot. The problem is if you wait till your symptoms have progressed and they've been around for so long, that's where we get a lot of issues. So what about tau, right? So we have plasma tau, and there's two different types, and they were looking at it in Alzheimer's versus other stuff and seeing how well it did. So what do they find? Both p-tau 217 and tau 181 had excellent diagnostic performance for differentiating Alzheimer's disease from other groups. Now, they did find that 217 was a little bit better than 181, but ultimately both of these work. And so for that reason, whenever I run labs on someone, I'm running p-tau 217. Once again, you could do 181 and that wouldn't be wrong, but right, trying to keep costs reasonable, we do 217. Now, we also do some of the other things they talked about in this one. Okay, we're doing hybrid amyloid beta and amyloid beta 42. Something else that I like running is called GFAP, so glial fibrillary acidic protein. Now, what did they find? Right, our findings. So results: plasma GFAP elevations appear a decade before expected symptom onset. So this is about being preventative, because if it goes up, you're dealing with inflammation, because that's ultimately where it comes from. After amyloid beta accumulation and prior to neurodegeneration, cognitive decline. So currently the lab ranges for these are pretty broad, but if you know where you're at, you are your best comparison. So if you get these levels when you're 40 or 50, and you then turn around and repeat them 5 years down the road, are you holding steady? Are you seeing more of a increase than we'd like there to be? These are things letting you know, are you in the good, or are you actually heading in the wrong way? So GFAP is one. Okay. Now, one other marker, right? GFAP as a potential biomarker. This is a systemic review and meta-analysis. Once again, our analysis revealed that GFAP level in the blood was higher in the amyloid beta positive groups than in the negative. Also in patients with Alzheimer's disease or mild cognitive impairment compared to healthy individuals. Therefore, they believe that it can be helpful to accelerate the diagnosis and improve the prognosis of Alzheimer's disease. So if you know where you're at, you can be in control. If you don't know where you're at, you're literally guessing. That's why with the brain, it is, and even the body as a whole, it's very, very concerning that people are letting symptoms drive so many things. Because what's one of the first signs of a heart attack? A heart attack. What's one of the first signs of a stroke? A stroke. But these are processes that usually have been going on until you get tipped over. So if you can find out what the processes are and where you stand, now you can do things in advance. Next, one of the other markers I run, neurofilament light chain. Okay. Neurofilament light chain is another one that we can get through most labs. Neurofilament light levels were significantly increased in Alzheimer's, dementia, and mild cognitive impairment compared to subjective cognitive decline. So subjective cognitive decline is what a lot of people have. It's where they're like, man, my memory's not that good. But you go and do a test and you just blow through it. You ace it. There's no issues from that side. But you just feel things are off. Versus, as we talked about, mild cognitive impairment, when you do this, there's actually some deficits that are being spotted. So what do we know? Right? Plasma neurofilament light levels might be a promising biomarker for neurodegeneration to discriminate cognitive decline due to Alzheimer's disease from other conditions causing cognitive impairment. Now, once again, do it with some of the other things. None of these tests do I necessarily recommend to be done all in one. Next, here's another research article, right? Where they went and reviewed stuff. Increased neurofilament light in plasma or serum appears to reflect the current severity of atrophy, hypometabolism, and decline of white matter integrity, which we talked about with the imaging. You can look at the imaging to say, how's the white matter health? What does ventricle health look like? Is it enlarged, which we don't want it to be? Is there atrophy of the brain, white matter, gray matter, certain parts of the brain more than the other? Because it's about taking these pieces of the puzzle and putting it together to say, like, hey, you know, how worried should we be? Or maybe we shouldn't be as worried as we are, right? But there are an abundance of labs. Okay, these are the fancy labs um, that currently insurance isn't covering, but I've got a pretty good panel that self-pay rate is just under $1,000 is really what it looks like to get that done. So I understand not everyone can get that done. Um, Someone says, is fish oil neuroprotective? I'm going to get to that in a little bit. Don't worry, I'll come back to that. All right. So, what are other labs you can do, right? So, we've talked about the expensive labs. We've talked about imaging. We've talked about the role of insulin resistance in the brain. We've looked at different factors that contribute from hypertension to diabetes to autoimmunity. Well, homocysteine is a marker that many people aren't even aware of. This is a blood marker that can be done. And what do they notice, right? Now, some people in the natural health community want a much better level than what this article says, but this is a universal consensus. Now, that's what it's important, right? This is an international consensus statement. So they are basically waiting for there to be so much research that says this is the way it is for them to agree. So what did they find? The findings are consistent with moderately raised plasma homocysteine greater than 11. Now, if you get your homocysteine labs, most of the labs actually let you up to about a 15, and they say it is normal. And this is why when I run homocysteine levels, I tell people, look, ignore the lab range. The lab range is garbage. Okay, it really is. If we wait for that, we let things keep going and going on. Now, because what they say, right? They concluded that plasma total homocysteine is a modifiable risk factor for the development of cognitive decline, dementia, and Alzheimer's. So get it looked at. So, thus, the public health significance of raised homocysteine in the elderly should not be underestimated since it is easy, inexpensive, and safe to treat with B vitamins. Like, literally, right? It's one of the easiest things to treat. It's pretty predictable depending on people's levels. It takes us about 6 months to get it down into a good spot. And then sometimes we have to maintain it. But there's the right combination of B vitamins that does really, really well. Now, this is a marker that does damage over time. So, knowing where you're at in your 30s, your 40s, your 50s, and addressing it is of significantly more importance and value compared to if you wait till you've got dementia. Okay, if you wait till you've got dementia and you treat it, probably not going to get any true benefits from that. Okay, sometimes maybe people feel a little bit better, but it's not going to be as predictable. So, talked about different labs, right? So we've got the fancy labs, we've got the tau, we've got um, amyloid beta, we've got GFAP, we've got neurofilament light, we've got insulin, we've got triglycerides, we have blood sugar, we have A1C, and everything else. So, what are things that you could do? This word here, man, this word, people do not like this word. Aerobic exercise. They do not like that word aerobic exercise, man. Saying, hey, you need to go out, go on a run, you need to play a sport, you need to get on an exercise bike. People will spend thousands of dollars on supplements and everything else on a monthly basis just to try to avoid exercise. Now, you cannot avoid exercise. It is one of the best things that you can do. Now, what do they find, right? Aerobic exercise in early Alzheimer's disease is associated with benefits in functional ability, exercise related gains in cardiorespiratory fitness, so heart, lung fitness, were associated with improved memory performance and reduced hippocampal atrophy. So, the part of the brain responsible in Alzheimer's disease that you're looking at in that neuroquant imaging, the hippocampus, physical exercise actually helped to reduce the amount of atrophy, which is awesome. And it's free. So everyone's trying to look what they can do that doesn't cost a lot of money. Exercise, even if you don't care to get ripped and to get toned and to look good. If you're worried about dementia, you should be exercising. Okay. It's just that simple. You should be exercising. Now, there's a lot of different reasons why exercise works in the way it does. We're not going to go into all those, but you know, exercise is something really good to do. And this is about the extent of what we are going to go into on what exercise does, right? So, exercise causes the release of something called brain derived neurotrophic factor. This is a growth factor, helps play a role in the blood brain barrier, astroglial cell health, ultimately plays a role in hippocampus function, reduces inflammation, and as a result, you see a shift in the microglial cells. You get neurons become healthier, and you ultimately can reduce inflammation by exercising. Versus if you don't exercise and you have the other factors with Alzheimer's disease, you get a disrupted blood-brain barrier. Now, this can be seen 20 years before diagnosis. This allows things from the periphery to come in, ultimately damages the neurons, causes the neuroinflammation, shifts you to a more inflammatory microglial state. Neurons die, more inflammation, cycle keeps repeating. So I cannot state how important it is. If you really want to prevent dementia, exercise is your best friend. Now, going along with exercise, what else should you do? Sleep, disordered breathing, and neurocognitive disorders. So sleep is one of the most important things, okay? Especially if you have sleep apnea, please get it treated and get treated the causes of it. So here they're showing some of the different causes for it. You've got alcohol, you've got diabetes, you've got obesity, you've got smoking. It tells you why each one does it. Ultimately, this can lead to cognitive decline. Okay. And there's different reasons why. You've got atherosclerosis, you've got inflammation, you've got small vessel disease. Now, when you do imaging, we find a lot of people heading to dementia have small vessel disease. And unfortunately, this is often considered normal for their age, which really it's not normal, in my opinion. And then chronic vascular changes, cognitive impairment, dementia, stroke, and other things. Okay. So, and once again, resistant hypertension can come from having obstructive sleep apnea. Just please get it treated. Please get it looked at. If there's any potential that you could have sleep apnea, it really should be treated. All right. And then last one. So going back to the insulin, right? So this looks at the role of health of insulin receptors in the brain. Someone previously asked about, well, what about fish oils and stuff like that? Omega-3s are fish oils. Okay. So a suitable diet with natural products, right? So rich in omega-3, which would be your fish oils, your essential fatty acids, your EPA and DHA, can be a non-pharmacological complement for the prevention of obesity, right? So changing your nutrition, reducing the amount of carbs, specifically processed foods, including sodas and drinks like that, is a great way to help lower your triglyceride levels in conjunction with good essential fatty acids. Because when you reduce this, you not only decrease the amount of inflammation throughout your body peripherally, but also centrally within your brain. So, this mechanism would have effects on prevention of central insulin resistance and improvement of cognitive processes. And then the adherence to a Mediterranean diet would reduce the inflammatory levels in the brain, which, with a decrease in the generation of mitochondrial stress. So basically, your mitochondria, energy producers of the cells, are healthier when your blood sugar and insulin is good. So I have people do more of a paleo style diet. So get rid of the processed foods, anything ultra processed, it's got to go. It's not serving you in any way that you want. Even if it tastes good for a few seconds, it's ultimately killing you. It really is. I like more paleo, right? Get your variety of veggies. I don't think fruit's the devil. Now, should you go crazy on it? No, right? Should you have berries? Yes. Nuts and seeds? Yes. Olive oil, avocado oil, stuff like that? Yes. Grass fed beef, wild caught fish like salmon, and different things like that makes a really, really good basis of a diet to help reduce the amount of inflammation that you've got to get you to a much healthier place. So I know that we've covered a lot. Um, if anyone has any questions, I will answer those, and I'm going to go through and see if there's anything else. But ultimately, dementia is something that I personally believe can be prevented, but it requires being proactive and not waiting for it to show up and then say, hey, what can I do now? We've got to be proactive so we can attack it, know where you're at. By knowing where you're at, you know how aggressive you need to be, right? Not everyone is going to have markers. And so you don't have to be as aggressive, but others do have markers. And you know, you've got to be more aggressive with what you do. It's ultimately about stacking the deck in your favor. The more you can stack the deck in your favor, the better your health is going to be, not only in the short term, but also in the long term. Until next time, this is Dr. Z. I'm known as the Brain Guy.